Thank you for your presentation, Yeva. It's much appreciated. Our next speaker is Dr. Professor Andris Skride, who is the head of the Pulmonary Hypertension Division at the Stradins Clinical University Hospital in Riga, Latvia. Dr. Skride?
So I will tell some things about our conferences. What are we organizing? So Baltic states, 3 Baltic states in the north of Europe, Latvia in the middle, Estonia in the north, and Lithuania in the south. As you can see, so in Tallinn, in Estonia, they have 2 PH centers. One center is located in Tallinn, it's capital of Estonia, and second PH center is located in Tartu. This is large university city in Estonia. And in Estonia, there are 2 PH centers as well. One is located in capital of Lithuania, in Vilnius, and second PH center is located in old, actually, this was old capital of Lithuania, Kaunas, city Kaunas. And in Latvia, we have only 1 PH referral center. We are referring here our patients already since 2007, when first PH specific drug was approved in Latvia, and this it was sildenafil. So I remember how I started to treat my first PH patient with sildenafil since 2007, and then after 2 years, bosentan and ambrisentan was available in Latvia, and then of course prostanoids comes in Latvia, and now we on early access program there is for 2 patients is availability to receive SOTA. SOTA is not yet reimbursed by government, but we are together with Yeva. We will fight, and hopefully after 1, 2, or latest 3 years, SOTA will be available in Latvia as well. Yes, we are part of, all 3 countries are part of COMPERA registry as well. And now we are registering actually not only group 1 and group 4 patients. You know that it's a lot of trials is coming for group 2 and group 3 as well. And now we are started registries for group 2 and 3 as well. If we are doing a lot of local science in Latvia, I have now 2 active PhD students. One my PhD student is working with echo and right cat, and one my PhD student work was connected with physical activities. But we are a part of randomized trials, and I put on one slide all ongoing and all trials which we will start in near future. So number 1, I am very happy that enrollment for Gossamer trial with seralutinib enrollment is ended, and so we will the results of phase 3 will be in December. I think the drug is very promising, and hopefully it will be one more target, anti-proliferative target to treat our patients with seralutinib drug. We ran in Latvia, we randomized 15 patients for this trial, quite a large numbers, and I think that, and actually our patients is happy to be on this trial. Yes, you see that actually for group 1, it's a good news for patients. It's a good news for all PH community. For group 1, a lot of trials is coming, and three companies will start trials very soon in Riga center as well. Already in September, you know, I think it's not a secret that Novartis will start a trial, and one company with monoclonal antibodies will start a trial, and 2A phase trial will one company will start with a protein kinase inhibitor. And of course, group 3 is very on the top as well. Now we started mostly cigoat in Latvia. We randomized already 2 patients, and we'll see what will happen after 16 weeks. Primary endpoint is PVR after 16 weeks. And actually, I am very impressed about group that some companies is working on group 2 as well, and we started to enroll our patients for group 2 PH tectonic trial, phase 2 with relaxin mimetic, and you know that relaxin is hormone, is potential agent with potential antifibrotic and potential some vasodilatation effects. And we randomized already 2 patients for relaxin trial, and I demonstrated this trial in our Baltic PH conference as well. And of course, we are working a lot with group 4 patients. We started our BPA program 3 years ago. Now together with our friends and colleagues from Warsaw, Professor Marcin Kurzyna, and then we are so results is good, and I demonstrated these results in our PH in our Baltic PH conference as well. What it is Baltic PH conference? Actually, it was our idea, our doctors, of course, with the patient organization, with EVA together. It was our idea to together with EVA start Baltic PH conference as every second year, and we started first conference in 2016. And at that actually at that year still treprostinil was not available in Latvia, and actually we reached a lot science first conference. Here is team members from Lithuania, Estonia, and Latvia after successful first conference. I will show, just for relax, I will show one painting from each country. It's summer, and actually my great grandfather is very famous Latvian painter, was of one of the impressionists of Latvian landscape painting, and here is one of his most famous paintings. It is from my private collection. Daugava is a river. Latvia's largest river is Daugava, and Pļaviņas is city. And here this painting was painted in 1939, and river Daugava near city Pļaviņas. So next Baltic PH conference was already in Vilnius. You can see Professor Torbitsky was there, and other prominent professors was there. So next, and here you can see a very famous Jonas Čeponis, Lithuanian painter, old gate from Vilnius, capital of Lithuania. Third Baltic PH conference was in 2020, and Here you can see very, very beautiful painting from Konrad Magi. Saaremaa. Saaremaa is island, one of Estonian islands, and it's a very beautiful place to go in summer. And yes, if you actually Estonia has a lot of small islands, and Saaremaa Island is largest islands from Estonia islands, and there is a very, very beautiful nature, and the fourth one, Baltic PH Conference, you are see our audience is growing, and it's only lecturers actually, and you can see Professor Sidborn was there, and colleagues from Lithuania, Estonia, and of course Gossamer helps a lot, and other companies. Thank you. And this is one more job from my granduncle, River Ogre. And fifth Baltic PH Conference was on 9th of May this year in Kaunas, Lithuania. So Kaunas is a very beautiful city, old city with medieval from medieval times, and what we discussed about a lot of things, and there was a state-of-art lecture from Professor Humbert. Mark Humbert was there, and spoke about future treatments, and there was some my colleagues spoke about challenging case of PH, and actually it was a great event. Great event. Yes, Mark spoke about current situation in PH therapy and future treatment, and of course about SOTA and ongoing trials. And as I already mentioned it, as group agent relaxin mimetic for group 2. I hope it will be promising, and 3 patients screened in Latvian center, 2 already randomized. We are looking for new patients, and this is I think this will, if we will find some agent for group 2, because all trials, all randomized trials previously failed. Tadalafil trial failed, other trials failed for group 2, and this will be, we will see. Of course, there was a lot of discussions about group 3, new treatments, and how we can classify group 3, and what we should do, and what we can do for group 3. We are, as I already mentioned it, in Baltic states, we are not only the part of randomized multi-center trials. There was local abstracts and presenters from Lithuania, Latvia, Estonia. We are doing every year epidemiological studies. Just we submit, so a week ago we submitted our Latvian article about Latvian incidence and prevalence for CTEPH patients in Latvia in 2024. Hopefully it will be published soon. So we started with Journal of Pulmonary Circulation. We'll see if it will be accepted. Then our incidence data about 2024 will be published very soon. And we are doing as well preclinical research here in Baltic states. One of my PhD students did a preclinical research with agent meldonium, and the aim was to show could meldonium, it's one agent, could meldonium help for a right ventricle in rat models with PH. Yes, and actually winner of abstract session was one third third-year students. So there is a lot of new scientists in Baltic states who are working with PH. And what so my student work was, so he prepared pulmonary arteries and wrote protocols for pulmonary angiographies here in Latvia. And so, for example, if I need to know, of course, I know anatomy, but if I need very quickly to know for which artery we are doing BPI, this name for my student is Matis. I am always asking Matis which artery or which segment is this, and after 1 second he's already telling this is A9 or 9. And so or new scientist is doing great work. And so for this model, Matis analyzed generations of pulmonary arteries. He measured together with our professor in anatomy. They measured all diameters, all millimeters and angles, and so it was a great work. It was some very practical and insight from Baltic states, from Baltic PH Conference. Thank you for listening. Thank you for inviting, and probably have some questions. Thank you.
Thank you. Thank you, Dr. Skride, for that comprehensive presentation. And it's quite exciting to see all the different clinical trials and research projects going on. I think some of the PH patients here are especially interested to learn a bit more about your work on the topic of quality of life. Could you tell us about that in a few words?
Yes, so we developed our own questionnaire, and yes, there is some ongoing local trials. We are questioning the patients, and when patient is entering in our registry, we are giving these questionnaires to each patient. We are studying at first how till diagnosis, how doctors was visited before real diagnosis was established, how patients feels on time of diagnosis, and how patients feel on treatment. So we are using these questionnaires a lot. And yes, one of our things what we are doing, we are asking always, actually it's very interesting, we are asking always, how many echo you did before you was sent to PH center? How many doctors was visited? It's actually very interesting point, and we will publish this data as well. Yes, but we are using questionnaires a lot.
Great, thank you. Yeah, we'll look forward to that publication that I think will shine more light on the diagnostic odyssey that some people living with PH have to experience and go through. Thank you, Dr. Skride, for your excellent presentation today. And